Hi, I'm so glad you're here. Today we're going to be talking about heart failure. We're going to be talking about a lot of information that comes from this book. We're going to cover stuff like what is heart failure, how to treat heart failure, including medications and supportive therapies. Watch out, you're going to see some familiar faces.
Hi, I'm Allie, and I am a registered nurse. So today I'm going to be talking about heart failure and giving sort of an overview of what it is and kind of how to treat it. So heart failure is super common and it's very treatable, but if you don't properly take care of yourself, it can do irreversible damage to your heart. So in heart failure, your heart continues to pump, but it's not pumping to the best of its ability. So we're going to talk about what can cause it. So some causes of heart failure would be coronary artery disease, which would be a narrowing of the vessels in the heart. A very common one is a heart attack because it can cause damage to the heart. High blood pressure, heart valve problems, which would include stenosis of the heart valves. Irregular heart rhythms are very common. You might know them as AFib or A-flutter. Kidney disease can also affect your heart, believe it or not. And also drug and alcohol abuse can affect your heart as well. So signs of heart failure, the main big one would be weight gain. If you gain 2 to 3 pounds overnight, and you would know this by weighing every single day, that is a telltale sign of heart failure. Or if you would gain 5 to 7 pounds in a week. Some major other signs would be shortness of breath, especially if you can't breathe while laying down, and swelling of the extremities and in your abdomen. A dry cough can also come with this. Fatigue and a loss of energy can come with this as well. So you might be wondering how we can treat heart failure. You need to weigh every single day if you are diagnosed with heart failure, so you can keep up with how much fluid you're gaining. You also need to restrict your fluid. It's probably a good idea if you talk to your doctor about how much fluid it's okay for you to have. Also, you need to reduce your salt in your diet and exercise to the best of your ability. It also might be a good idea to ask your doctor what exercises are appropriate for you. It's always a good idea to stop smoking and to restrict alcohol intake, and it's best if you actually cut it out. If you properly treat yourself at home, you reduce your risk of ending up in the hospital with heart failure. So if you have heart failure, you will probably be on some medications. So here are some popular medications that you'll probably be on. You'll be on a diuretic, which the main one is furosemide or Lasix. Lasix gets rid of the fluid by making you go to the bathroom a lot. You need to watch out for your blood pressure. And a good way to remember is there's 6 in the word, and you'll probably be going to the bathroom for about 6 hours after you take the medicine. Then a lot of people are on beta blockers. These usually end in LOL, and they would be called metoprolol or carvedilol. These help your heart from beating too quickly, but you also need to watch out for a low blood pressure or heart rate. You could be on an ACE inhibitor. These end in pril, just like lisinopril. These would help the heart to relax, and it also reduces the heart failure symptoms. But you must notify your doctor if you start to cough or there's swelling of the mouth and airway. You could also be on a statin, which is for cholesterol. An example would be atorvastatin. These help to reduce the bad fats in the blood. You must take these at nighttime, and you want to watch out for muscle pain and notify your doctor. A lot of people could be on a calcium channel blocker. That would be amlodipine and diltiazem. These also help to relax the heart vessels, but you absolutely cannot drink grapefruit juice. Watch out for swelling or if you feel your heart rate become irregular. You could also be on an ARB. These end in sartan, like valsartan or losartan. These also help the blood vessels to relax in the heart, but you must notify your doctor for muscle aches and swelling of the mouth and airway. So as you can see, most of these medicines have to deal with the blood pressure and the heart rate, so it's probably a good idea to have a blood pressure cuff available at home and to check your blood pressure and heart rate every day before you take these medicines. And it's probably a good idea to have a list of all your medicines, especially for when you come in the hospital, so everyone is aware of what you're taking at home.
All right, so I'm going to talk to you today about the kinds of heart failure that your doctor might talk to you about. The doctor can usually tell what kind of heart failure you're having by the symptoms that you have. So the two kinds that we're going to discuss today are left-sided and right-sided heart failure. So if you have left-sided heart failure, the symptoms you normally see will be you're extremely short of breath, especially at night when you're laying down. And what is happening is that the blood and the fluid in your body is backing up into the lungs, which makes it harder for you to breathe. So you might have a very dry, hacking cough. It can be especially hard to breathe when you lay down at night when you sleep. And you might be fine during most of the day, but then you lay down and all of a sudden you just can't breathe. And if you know people who sometimes have to sit up or sleep in a recliner or propped up on several pillows, this could be a sign of possibly something's going on with their heart. Now, the other side is right-sided heart failure. And with that right-sided heart failure, that's usually dealing with the two chambers on the right side of your heart. That's more part of your venous return, or the blood flow that goes throughout your entire body. So what happens with that one is usually you notice some swelling. So the swelling can occur all over your body. Some people it's the legs, some people it's the belly, and some people it's even their arms. But what is happening is because the heart can't push the blood and the fluid through efficiently, it starts backing up in our system because it doesn't have anywhere else to put it. So the fancy word for swelling is called edema. So if you hear the word edema, that just means you're swelling. And because of this edema, one, it makes it harder to get around. It can be painful. Sometimes legs will even weep and ooze fluid, and that's a sign that you've got too much fluid on you. You can also sometimes have effects on your kidneys because all this extra fluid is going around. That increases the pressure in your kidneys and through the rest of your system, and after long term, it can start affecting your kidneys as well. So the medications, of which someone's probably already talked to you about, we do is to help get that fluid off of you, and unfortunately the best way to get fluid off is to pee it out, and lots of peeing. The next thing I'm going to talk to you about, though, you might hear your doctor talk to you about your ejection fraction. Now, your ejection fraction measures the amount of the percentage that your body is pushing out from that left ventricle. Now, remember, your left ventricle, that big, strong muscle, it's the main pump of the heart. And it's what sends your blood all the way through from the top of your head to the tip of your toes. So we measure that, and the normal ejection fraction is considered 55 to 60%. Now, that is a normal ejection fraction. People often hear that their ejection fraction is 50% or 55, and they get panic-stricken because they think, oh no, half my heart's not working. That's not true. That means that's what it's supposed to be at. But it's also a good indicator of how well your heart is functioning. And so they'll do that test several times, called an echocardiogram, to measure that ejection fraction, to kind of show the progression of your heart failure, or if it's worsening or even improving. But you can even have a normal ejection fraction, though, and still have heart failure. So that's a possibility also. So just kind of keep that information in the back of your hat if you ever need it, okay?
Hi, my name's Ashley. Today we're going to talk a little bit about congestive heart failure education. I've got 3 things that you can do at home to help keep you out of the hospital. The first thing is we're going to weigh every single day. Weigh at the same time every day, wear the same clothes every day. It's not going to do you any good if you wear your gym shorts one day and your steel toe boots to get ready for work the next. So you're going to want to call your doctor if you gain 3 pounds in one day or 5 pounds in 3 days, because that's not our Thanksgiving turkey weight. That's fluid that we're holding on to, and your doctor might be able to give you some extra medicines to keep you out of the hospital. The second most important thing that you're going to want to do is watch your fluid intake. A lot of people say, well, the more fluid, the better, it keeps me healthy. That's not always the case with congestive heart failure because less is more. We're going to want to drink 2,000 milliliters a day, which is equivalent to 4 water bottles, and that includes everything that you drink, whether it be tea, coffee, your milk, your juice, anything that you're drinking throughout the day. A 2-liter bottle is about all you can have. And that just helps keep the fluid off of you, to help keep that shortness of breath away, help keep your body flowing in the way that we want it to give that heart a little bit of a break. The third most important thing that a lot of people struggle with congestive heart failure is your salt intake. This is our best friend a lot of the times. How many of us just shake it all over our food and don't pay attention to how much we're actually using? 2,300 milligrams of salt is what a normal person should have. For a person with congestive heart failure, we like to say 2,000 milligrams in a 24-hour period. How much does that equal out to? A little less than a teaspoon, which doesn't seem like a lot at all. But the more you try and the more you do, we can kick bad habits and get rid of that salt a little bit at a time. So a couple of things that you can do is measure out your salt every day. You can use this teaspoon and kind of use it throughout the day, salt your food with it, and go on. A second tip that you can do is look at your labels when you're getting your groceries. So I went to Walmart, and both of these cans of pinto beans cost the same. They're the exact same amount of money, but they're very different in the sodium content. This can of pinto beans has no salt added. This one has regular salt. So if you look at the label, the serving size is a half a cup, and there's 3.5 servings in each of these cans. They're the exact same amount. The sodium in the regular can has 410 milligrams. So you're eating half a cup, and you've got 410 milligrams already gone for the day. The one with no salt added has 20 milligrams of sodium for a half a cup, the exact same amount, and you're getting the same amount of food for a whole lot less sodium. So less is more in this because you want more food, less sodium. A lot of people say salt makes pinto beans taste better. You do have an alternative, the Mrs. Dash Diet. It's a type of seasoning that you can get at your grocery store. It helps season your food. You know, it's not the same as salt, but it definitely gives that seasoning that we all like and we've grown to love without the harmful effects of too much salt. So those are the 3 tips that you can do to stay out of the hospital if you have congestive heart failure. Weigh yourself every day, watch your fluid intake, and watch your salt intake. Thank you.
All right. Hi, my name is Becky. We're going to talk about some heart failure education. So first thing I'm going to talk about is this calendar. So when you have heart failure, you definitely want to weigh yourself every day. You want to weigh every morning before breakfast. And then it's good for you to track your weight each day. I always tell my patients, if you gain more than 2 pounds in a day or more than 5 pounds in a week, you need to let your doctor know because you may be retaining fluid and they may want to increase your fluid pills. So next we're going to talk about your heart failure flare-up zones. So you're in the green if you're not gaining any weight, you're not short of breath when you're up and active, you're not having any chest pain. So of course, weighing every day, taking your meds as prescribed, following a low sodium diet, that means you are in the green. So when we start to get concerned is when you start having symptoms in this yellow section. You have a dry, hacking cough, you notice you're having a lot more swelling, you're getting short of breath when you're getting up and moving. When you get to this point, you want to at least let your doctor know because they may want to increase your fluid pills for a few days to help prevent you from having to go to the hospital. And then in the red is when you've gained more than 2 pounds in a day or 5 pounds in a week. You're having the cough, you're short of breath even at rest. Definitely seek medical attention or call your primary care doctor so they can treat you the way that you need to be treated.
With heart failure, you definitely want to stop smoking. Nicotine can cause your arteries to tighten, which can lead to high blood pressure and even a heart attack if that goes untreated. Nicotine replacement therapy can double your chances of stopping smoking. There are several different ways that you can achieve nicotine replacement therapy. They can come in a nicotine gum, a lozenge, or even a patch. Nicotine patches are probably the most common and often what patients would prefer to use, and a lot of hospitals will use those to prevent those cravings that you may have with cigarettes. And so it's important to talk to your doctor before you're discharged to see if you can be prescribed these to stop smoking on your way home. It is also very important with heart failure to balance your activity levels as well as your resting. With heart failure, it's very important that you continue to maintain activities, and these can include walking, swimming, biking, anything that increases your heart rate and allows that blood to keep pumping through your body. And there are several warnings and indicators to use before you start activity and while you're doing activity. So the first one is to make sure that you take it slow and easy. You want to be patient with yourself, especially if you're just coming out of the hospital from a heart failure exacerbation, or even as your heart continues to recover after you're discharged. You definitely don't want to push yourself too hard. And this leads into the second point, to pace yourself. Make sure you don't start to go too fast. You want to go slow and then see how your body cooperates with yourself as you start that activity. And you also don't want to go too heavy at first. You want to lighten up your load and see how light you can do it before progressing to something heavy, as you may have initially been able to do before diagnosed with heart failure. And finally, avoid the heat. Anybody, even without heart failure, can feel like they're getting extremely exerted while in the hot sun. So make sure that you have extra water bottles with you. Make sure you stay in some air conditioning to avoid your heart from getting under too much stress. And of course, you want to stop all activity if you experience any shortness of breath, any chest pain. It can be in your chest or radiating down your back, down your shoulder, any dizziness, lightheadedness. Make sure you stop, call the doctor, and of course, call 911 if that chest pain does not subside.
Palliative care is a specialized medical care for people with serious life-threatening illnesses like congestive heart failure. It focuses on providing patients with relief from the symptoms, pain, and stress of a serious illness, whatever the diagnosis. The goal is to improve quality of life for both the patient and the family. Palliative care is provided by a team of doctors, nurses, and other specialists who work together with patients, other doctors to provide an extra layer of support. It is appropriate at any age, at any stage in a serious illness, and it can be provided along with curative treatment.
Thank you so much for watching our video. We hope you've learned a lot. If you have any questions, please direct them at your primary nurse.